So our task force was struck sort of mid to late summer, and it's a combination of 25 people from our region, a large number of people from Muskoka Algonquin Healthcare, our board, from foundations. We have municipal representation on the board. We have people with lived experience. So there are a number of people that are providing us with input and their information. It's probably the biggest group of people that I think we have assembled in order to discuss healthcare and future planning for Muskoka.
And I mean, Natalie, having this task force, and you're a member of this task force as well, I mean, it's sort of providing not a different direction than what was done with the board in the past, but just I guess a more focused, I don't know what the right word, more of a focus on deciding what to do with our healthcare in the future, right?
Absolutely. So what this task force is designed to do, as Cameron's indicated, it's a very broad representation, which is quite different from what we had in the past. It was dealt with more by a hospital committee historically, with input from people in the community, but this time it's actually more of a community-driven task force with some hospital representation on it. Their mandate is to come up with a recommendation and to bring that recommendation forward to the board. Ultimately, it is the board that has the final say or makes the final decision.
Now, so let's talk about, an update was released last week, and you've been periodically sending updates along the way as to where we're at with the task force. So what is the update now? Where are we at?
So every 2 weeks, our task force meets. We meet 7:30 in the morning on a Monday morning, and I'll say we have great attendance. Very, very rarely do we have people that call or don't show. So we've had our 8th meeting now, and at our most recent meeting, we discussed a day-long seminar that we had where we had clinicians were all put into a room. We had board members there and task force members there to watch, just to learn about the process that they were going through. And they were putting together a plan, let's say, to really determine if you were to have an inpatient, outpatient model hospital, what would that look like?
Okay.
So that was a day-long session that we had, and it was great to have the number of people in the room that we did. Again, we invited 70 people, give or take. I think we filled the room. And we had ambitious goals. We had hoped that we would get a little further than we got, but I think you always need to have stretch goals.
Well, let's talk about, so that's the inpatient, outpatient, that's one of the options, right? That the task force is looking at, one of 3, right? Of course, there's that one, and there's the one hospital, what's the third one again?
2 sites.
2 sites, right,
quo.
yeah, the 2 sites, non-status quo, that's right. So what did you find in this meeting with the inpatient to outpatient? What was more interesting, or that maybe that you didn't know before, that broadened the scope for the task force?
I think for me personally, I'm a generalist. I'm not a clinician in an acute setting.
Right.
So I was really more of a fly on the wall. So to have all the people from, clinically that were there to be able to say, all right, if you need ICU in a single site, what do you need to support that?
Right.
If you're going to have obstetrics, what do you need to have there? What does it look like to have ER? Do you have to have all forms of diagnostic imaging? So those were the questions that the clinicians were openly discussing. It was the what if, the think outside the box, and I think they captured that really pretty well.
Yeah, I would say that I think there was a reaffirmation that some of the work that we had previously done around that particular model, so one site being a non-bedded site and the other site being where all the acute care beds would be, actually is a viable model. So I think that was confirmed at that workshop. Doesn't necessarily mean that that's the one that's going to be selected, but with that broader group of clinicians and some different players in the room, there was confirmation that could work, and what would it look like. So historically, we had developed the one hospital site model in a central location. I think that's fairly well understood by people. What we're wanting to do over the next little while is flesh out more that bedded and non-bedded site, and then the next workshop that we're going to be doing in January, we'll be looking at the 2 site
Okay.
non-status quo. So that way we could be a little clearer with our public, with our community, as to exactly what we're talking about when we're talking about the three models.
And perhaps what will work and what won't work. So you're saying
Yes.
that this inpatient, outpatient, I know there was some challenges with the previous boards that having the two sites would pose a bit of a challenge considering the funding model that we're in currently.
Right.
Again, that's not to say that the decision has been made. That's what this task force is for. So let's talk about the scheduling. So you just touched on the next workshop. So where do we go from here now in terms of making that final decision? What do we predict for the next year?
So, so we'll be looking at that second workshop to flesh out that model. Go back to the first model that we had, which was the one hospital, a central location, make sure that we've crossed all the T's and dotted all the I's on that one. Then look at the criteria that we've been developed with public input that we've received through the survey. Come up with some recommendation as to which of those three models the task force wants to continue to pursue. In the meantime, as we're looking at that, we will more than likely go back out as well to garner more feedback from the public.
So, I mean, for you yourself, you just said that you're not a clinician. You're just you're there as a resident who cares about healthcare. What is it that you're hoping to see in the next year with the future of our healthcare here?
Well, in the next year, specifically from a task force point of view, I'd like to get to the point where our task force has consensus that we're going to recommend a model to the board. So I think that's first and foremost what my goals are as chair. As resident, I want to make sure that we have a viable system that provides safe, quality health care that's accessible, that meets the needs of residents. That allows some flexibility so things can grow. I mean, what we're talking about is something that, if all the I's were dotted and the T's were crossed, it would probably be 15 years before we would be looking at a new build.
Yeah.
So, we're looking that far down the road. So those are the things that I'm hoping to have in place.
And what about you and Natalie? I mean, like this is one issue of a bigger picture. I mean, ultimately the bigger issue really is our funding model as well, right? That in general. So once the task force has a recommendation, whatever that is, and once the board adopts said recommendation, what does that do to the future fight for more funding? Or is there going to be is that the next step to push to change the funding model?
Well, in many ways, they're two separate agendas.
Right.
So the funding formula is obviously a factor that we want to look at when we're looking at the models, but it's not one of the driving forces. Separate from the capital planning that we're doing, we are engaging with the Ministry of Health and with the Ontario Hospital Association to really look at what changes need to occur with the funding in order to be able to be better positioned to provide the care that our community requires.